Welcome to Healthcare Quality and Risk Matters, the show where we dive into the topics that matter most in healthcare quality and risk management. Wondering about patient safety, quality improvement, or risk mitigation, but weren't sure who to ask or were afraid to ask? Well, you're in the right place. We create a safe and judgment-free space to explore these critical topics together that will leave you informed and inspired to make a positive impact on healthcare and patient outcomes. So let's learn and grow together because healthcare matters.
Well, hello everybody and good afternoon. My name is Gary Bierce. I'm the CEO of Aperitisoft Healthcare, and I'm joined by my co-host, Rob Santamore, who is our Chief Operating Officer. And today we have an esteemed guest. We have Cedric Robertson with us today, and Cedric is the Sales Director over at Sonoma House Senior Living. We're glad that everybody is here with us today. We're very excited about this. Everyone has somebody who is in an assisted living facility today. With the aging population we have, assisted living, long-term care facilities of all types, whether it's rehab or skilled nursing, are playing a more and more a major role in our healthcare system today. And November is the National Long-Term Care Awareness Month. So in this particular episode, we're going to be focusing on how can we strengthen the trust in senior care since it's a growing part of our industry. And Cedric, welcome aboard today. We're excited to have you here. Can you take a few minutes and just tell us a little bit about your background, and then we'll dive into our topic for today.
Yes, sir. And thank you guys for having me on. I've been in senior living for a little over 7 years. I'm a retired firefighter, and my grandmother worked in a nursing home her whole life. So I grew up in a nursing home. And then when I retired, this has always been a passion for me, seniors and serving seniors. And so this role fits perfect for me.
Fantastic. Hey, for our audience out there, hey, thanks for being here today. Go ahead and go into the chat. Tell us where you're from. We'd like to hear from you. Also, as we're going through our conversation today, if you have any comments, questions, do not hesitate. Put those out there in the chat. We'll try to respond to them to the best that we can. Let's begin. All right, guys. Let's look at the elephant in the room. We all know that long-term care has the worst reputation out of all the different healthcare segments of the industry. And so I'm going to ask you guys a straw poll. Why do you think this is the case? Cedric, you're our guest. You get to answer the poll first. Why do you think this is the case?
I think, the age group now that is going to assisted living and memory care, for them, they just feel like it's like families are putting them there to die. They don't understand, all of the benefits that assisted living, memory care and long-term care living has to offer. And in their mind, they feel like they're losing their independence, maybe their dignity, and they feel like it's going to be less than instead of more. And so I think that comes with that as well.
I
My
love
opinion.
that you immediately took the patient and family perspective. And that is fantastic. Because my main point was going to be about the culture, and the culture is about seeing the patients, as people to be cared for, as people to ensure that they have the most home-like environment, that they are safe, happy, and comfortable. There's in their space, and that they're living their golden years out in the best, highest quality of life possible. And I was thinking about it as just the care staff, the nursing team, and the leadership, creating a culture that believes that and enforces that and practices that. And I love that you immediately went to the patient. There's
And I
definitely,
100% agree
yeah.
with you as far as the culture that comes like right underneath that, and that's super important
Mhm.
and a very important piece. Yes.
I love that, because if we're not seeing the patients as patients and we're seeing them as tasks, if we're not seeing patients as there's other people's family members, as human beings, as there's, again, not a task, and our culture doesn't support that, then we're not providing highly reliable care. We are not providing top quality care. and we are not strengthening the trust in the care provided by there's these other organizations. And frankly, if we don't care about it, we're also not collecting data on it, on how to continuously improve it. And we're just kind of staying at that bare minimum. Like Gary, you talked about that MVP, that minimally viable principle, like meeting only the bare minimum requirements. And no sector of healthcare should ever strive for that.
No. But I think budgets and how they're trying to manage the profitability and regulation sometimes allows it to be legal. And here, I'm always talking about my family. But, just recently, Rob, you recall me telling you about my father-in-law's historical issues with having a hard time being in the ICU. They put him automatically in Tesla, which is an institution medication. We got into long-term care. We had to struggle to get him off of it. He was finally weaned off of it. Well, then eventually he went home, okay, for a period of time, and ultimately ended up in assisted living. He's in assisted living, and he becomes a little bit more difficult to be able to get out of bed in the morning. He gets very, very stiff. So it's a neurological issue, okay? They eventually say we can't take care of you anymore, and we need you to leave. Basically booted him out. We don't have the certifications to handle him anymore, okay? And it was pretty abrupt. You got 30 days to get out of here, right? Interesting. We go to the new place, okay? Doctor comes in for the first examination, and we hear he's back on anti-seizure medication. The family had no idea that happened. No idea whatsoever.
I have concerns about informed consent.
I mean, it's to me, again, I don't know if it's like you say, culture. If it's a culture thing that they need to understand when people are reaching 90 years old, families involved in what's going on with decision making for their care, and there have been documents signed to prove that they absolutely have to make sure the family's involved.
Yes.
And this gets missed all the time. So I guess when we talk about incidents, that was a big fat one right there that happens along the way, right?
And I remember one of the social workers that I worked with when I was an ICU nurse, and he was so smart. He would do an amazing job at finding the right long-term care organization so that there's projected and anticipated future care needs are completely met, so that patient isn't bouncing around.
Yeah.
Not, all right, what meets their basic needs now, right? That minimally viable principle.
Yep.
There's how do we get them out of this bed so we can turn this bed over and move them to this bed? There's like, what are we collecting for information about our patients and about the facility that they're going to? There's to ensure that people don't have that experience, right? Because that left a bad taste in your mouth. There's
It was a shock. It was a shock because we thought we finally had him off of this stuff.
Yep.
And who knows what side effects that was causing and why he was on it. We don't even understand why. You know, it should never have happened. But Cedric, obviously, I mean, we normally do incidents of the month, and I kind of stuck the wing on you there, Rob. I know we weren't going to do that.
Okay.
But
it's a real life personal example. That's great.
Yeah. But Cedric,
communication.
Thing to react to. You've got a lot of experience in this industry.
Yes, sir. And communication.
How do we get there from here? How does it happen? How do we get there from here? You know what I mean?
Yes, sir. The first piece, communication, is important. And, you know, these are big moves and these are scary steps for the family and the resident. And moving them from facility to facility where any change is detrimental to the mental health. And also, they're trying to get comfortable. So it's important for communication to be there. And it's important with the family, the directors, the caregivers, a cohesive unit. It takes a team and a tribe for this to happen. So communication is super important from the beginning in any of these situations.
Yeah,
totally agree. We always advocate. There's any of our clients. There's an assessment. Where are you? Right? Like You need to develop your culture and your cultural goals. There's where do you want to be, right, in your strategic plan, but knowing where you are so you know which is your next step to take is
Yes.
extremely important. And I do know that there is um, a lack of support in the quality, process improvement, risk management. There's space for long-term care organizations. We ourselves have consulted with a couple, and it was surprising because we're mostly like, ambulatory and inpatient. There's acute care, right? There's to see that they don't have large scale departments. Or even small scale departments in many of these long term care senior living facilities. It's left maybe to a corporate enterprise model where there's not a lot of local attention. It's
Yeah,
left
like, I wonder though, Rob, how much reporting is really coming back to corporate
so
on
very
incidents?
minimal.
Yeah,
Um,
Yeah.
at least in our experience, there's reporting for things like sentinel events, right? That MVP, the minimally viable principle that Gary spoke to. There's what do we have to report versus what is reported, right?
Yes.
Hospitals consistently report there's by DNV Joint Commission standards or Pop Health or like NCQA standards. What are things that are good catches, near misses, process improvement opportunities? Those are captured on a continuum because they are required. And the people that we have partnered with, there's senior living, long-term care, senior care space. There's consistently report sentinel events only to us. Right, there was a never event where a patient fell with injury or things like that. But when it comes to coaching them through reporting a near miss and a possible medication, there's error. I remember speaking to a shift lead. There was a punch card, like the medications in long-term care come in like these card things, and like you punch pills out of them, and they sort them by like patient bin.
Mhm.
Um, and they actually had a medication in a wrong person's bin. They didn't pass it incorrectly. They moved it to the right person bin. But to me, that was a quality improvement concern. That was a quality opportunity for error. And that should be reported. And we
Yeah.
can track that. How often is that happening? This is an identified potential risk. Somebody
Mhm.
blindly punching out medications, there's just going to punch everything in that like bin. And they were just like, well, it didn't reach the patient. We didn't have a med error. Right. It's developing that culture of how do we continuously grow? And it's by identifying potential risks and not just reacting to things that already happened. And
right.
it's
Well,
sorry,
the
I
system.
can keep going.
Let's bring that up anyway. We've established over this year, right? Healthcare loves to react anyway. It's built into regulation, right? You report the incident, you evaluate the incident, and then you correct it, and then hopefully put in preventative action. So it's
Mhm.
always in the rearview mirror, rarely looking to anticipate, right?
Yes.
So if we're already there, that's from a risk manager's perspective. You're going to see this with me a lot, Cedric. I'm a risk
Mhm.
manager, so I dive in with things. That
Okay.
already is below the minimum bar, in my
Yes,
opinion,
sir. It
right?
is.
So now we lower the bar even more in long-term care because we've seen it, Rob. They have a clipboard in the break room of the facility, and that's their incident reporting technique,
Yep, it is. That's a
right?
real example. Yep.
So I'm sure they see a whole lot more in a given month than are actually finding their way on that clipboard.
100%.
And they have so many confounding factors to that. And we do acknowledge that for all the listeners. We know that staffing and funding and all of those things play a part in there's a facility's perceived ability to tackle some of these things.
Mm-hmm.
But we have seen it time and time again where when the culture of the organization prioritizes quality,
Mhm.
there's then the efficiencies in your process, the talent you're able to recruit, there's the funds you're able to retain, there's do overall improve your organization. And with a better organization is better patient outcomes, better reputation, better everything, right? There's that culture has such an impact. There's on where your team and you are investing your time and money.
Mhm.
And with that right time and money investment, there's those patient outcomes are significantly better. There's
Now, we have talked about before, and maybe we should put that out here and kind of give it as a backdrop for the balance of our half hour here, looking at where do we think the root causes are connecting from, right? What are these places where it creates the problems that we're seeing downstream? Okay. We've talked about it, and I think we all agree that there are four legs to this table that are causally making things happen that either are real legitimate problems or at the very least creating a reputation problem. Okay.
Yes. Yep.
So, number one, you guys said it, and we can say it over and over again, is culture, right?
Yes.
The culture of the organization has to be the correct culture. Two, they can't have an attitude that profit before patient, meaning I'm going to do the minimal amount that I need to do to be compliant.
And good patient outcomes is always good profit line. Always.
Exactly.
Yes.
If I take that MVP principle, right, I'm going to be having issues with reputation or legitimate problems.
Yes.
The other thing is insurance. Assisted living, not so much, but when you're getting into rehab and skilled nursing, insurance ends up playing this huge role.
Yes.
And what goes on with the healthcare package that's coming to the patient. And it's to some degree it happens in assisted living, particularly when you're dealing with physical therapy and occupational therapy and things like that.
Yes.
And then lastly, you have restrictive regulations on these organizations that limit their ability to do more. And so let's throw those out as the four legs of the table, and let's discuss it a little bit.
I'm sorry to interrupt you guys. For assisted living or for these facilities, leadership, the executive director, is going to set the tone for that community. And
culture setter, you're saying they're the culture.
Yes, sir. So that can be for the better or for the worse. The backbone of the community is going to be the caregivers. So leadership has to be strong. They have to communicate, and they have to also check on the mental health of the caregivers. We want to make sure that we're supporting. Caregivers need to feel supported. If they don't feel like they can go to their leadership and communicate properly, they will make these mistakes, and they will cover themselves, and we won't be able to see those mistakes because they could be scared of getting in trouble or maybe getting talked to. They're making a significant lesser amount of money than the directors, so it's a fine dance and a balance. So the leadership really has to be attentive, not to just the numbers, but they have to be attentive to the caregivers too. And then the result is going to be a great reputation and great resident results and happiness.
Right.
Agreed. Gary, you also mentioned like insurance and regulation, and I think that insurance regulation and that minimally viable principle, they all end up supporting that same table that you were speaking to. And I think that those three legs are exactly the same.
Interesting.
As far as how they function under that like minimally viable principle. So like last month, we had Dr. Christy Flake, who described that MVP as hey, I can have like a 1-star hotel because I'm meeting those hotel regulations to be a hotel. Or I can be a 5-star hotel because I have now implemented quality. And that is the difference, right? Regulation versus quality. Quality brings you to a 5-star. Regulation keeps you open. It keeps you doing the minimum required to function as that organization. And then insurance, in a way, does that same thing. Right, wrong, or indifferent space that we're in now, insurance does dictate care. But good quality, good data will tell you whether or not your utilization review management team are your nurses doing a good job, right? You have a utilization nurse is looking at there's your patient profile, there's the diagnostics received, the treatment received, the future care plans. And how well are they digging into those patient needs versus what is being paid, and then how are we justifying what is needed so that that is covered, so the patient is there's as comfortable, as well cared for, there's as possible. Inequality can have a massive impact on that. Instead of doing the minimum, be like, yeah, here's a list of everything that's covered for my patient. Yeah, we got them all this month. There's why don't we dig a little deeper? There's figure out what they actually need. There's what did the last fall assessment look like? What did the last skin assessment look like? When was the last PT eval? What was the OT eval, speech and language pathology eval? And then what can we start adding? Right? Once you start adding ICD-10 codes, you can start adding additional. There's CPT2 codes, right? So there's getting good quality in place on those three legs. There's will help strengthen that overall table, and it all kind of functions the same way. But again, to Cedric, your point, the culture is what drives that. How hard are
Yes,
they
sir.
going to work for the patient? Are they going to work with quality in mind, or are they going to work to do the bare minimum?
So, Cedric, in your experience, okay, you've seen great facilities and you've seen facilities that are struggling.
Yes, sir.
First, let's look at the ones that are doing well. What do you think? What is the one thing that you think makes the difference between one who's doing well and one that's doing poorly?
Leadership, leadership that is working not for the paycheck because it's their passion and it's their purpose,
Okay.
and that is infectious, and that makes your team work harder for you when they see leadership is consistent with their actions. They listen to their staff, and they have a cohesive unit. They're not individuals. There's a team. So the great communities, assisted living memory care, the leadership sets a team, and then that stops turnover. It slows down turnover. Residents are happier. Their families are referring more. And instead of having placement companies supply leads, it's organic, coming from family referrals, from
That's
home
like the
health hospice.
HRO of long-term care.
Yes,
Yeah,
sir.
that's
Yeah,
And,
I mean,
and
you just described Irvana, right?
and
So what
the
happens
poorly
usually?
run.
What's the down spiral look like? So if we got listeners out there and um, things are starting to go wrong. What are some of the red flags that you can share with them to know they're beginning the down spiral? What would you?
uh, the down spiral for their family member or for the community that they're
Well,
seeking.
from a quality perspective, what you described, perfect quality, right? Everything's
Yes, sir.
working well, everybody's happy. All of a sudden, complaints are starting to be on the rise, right?
Uh-huh.
Um, Suddenly, you have people bailing out, leaving the facility,
Yes, sir.
right? So,
Turnover.
they're all symptoms or metrics, but what are some of the root causes that you can share with people, or what's happening behind the scenes that are leading to that bad outcome?
What's happening behind the scenes is the higher up, meaning the regional, the vice presidents, the CEOs, ownership, they're looking at numbers. These jobs are stressful. The daily, it's a 24-hour job. And the higher you are in a community, the executive director, marketing, and nurses, that is a high level of stress. There's more numbers. And so when you're focusing on numbers, those are sometimes things that you can't control. You can control, how we market and how you get out there. But when this stress and these numbers come and they're holding leadership accountable, sometimes mistakes are made. But to mental health, people just quit and they go to another company that has a maybe a lesser standard, or maybe they operate a little different. But the stresses come from the numbers. Um, the back door, you can't control this. Sometimes people do move out, and you have to replace those people, and that comes with a high stress level. So stress from numbers is the leader of why leadership turns over, and then it trickles down into the caregivers, and that's why 75-80% in this area turnover is really high in caregivers, and it's starting to be even more in top leadership in communities.
So, based off of
Stress.
your analysis there, if you're the consultant and you're going into a failing assisted living facility, the first thing you're going to tell the ownership is hire quality leaders. Am
Mhm.
I right?
Yes, and sometimes they might not come from the industry. So I came from outside of the industry. Sometimes people have habits. You might want to hire people outside the industry that have the passion, and you can teach them. Like I'm a prime example. I have a
Interesting.
passion to serve. I'm not from this industry, so I don't have those habits of somebody that's been here for 15 years, worked for one company. They're comfortable. Like as there's a certain way that I do business, kind of different, with more compassion. I'm listening. I can adapt. I can adjust. I think if we look to people outside of the industry that have a passion for seniors and servant leaders, and we give them the tools, I think they would be highly successful. And I'm one of the examples.
I love that. And Cedric, while you were talking about numbers and the leadership reacting to numbers, there's and for those just listening and not able to see, there's when Gary said they need to hire quality leadership right away and to respond and to act and to be proactive and smart about these numbers. There's I thought it was funny, so I held up a piece of mail on my desk where I put there's no quality means no context. There's and so like I was saying the same thing that Gary was. There's so when you have there's corporate leadership or enterprise leadership or even local leadership reacting to numbers with no quality team to help there's interpret and operationalize and understand those numbers don't have any real value. There's
Yes.
and that might be controversial to say, right? We talked about how important numbers are and numbers can't be argued with. There's but when you have these arbitrary numbers that are assigned to something, there's no context built into it, there's has no value. There's
Yes.
for the fact that all right, well our turnover rate is 38%. Our there's incident rate is 1.2 incidents per bed per month. There's however you calculate it. There's that doesn't have any context without root causes, apparent causes. What are quality initiatives? What are not quality initiatives? What is a logical outcome versus an illogical outcome? What makes sense for industry standard? What makes sense for best practice? There's if you are not investing in quality, those numbers don't mean anything, and you're reacting to things and making large operational changes that are affecting patients and your reputation.
You're pointing right back to what we say over and over and over again. If we're using manual systems that
Like the
are not
clipboard and
working
the breaker.
together, it's not going to help you to prevent the down spiral,
No.
Uh-huh.
right? So first of all, you want systems that are bringing the right metrics, the right things forward, in addition to what's required of you, okay? And you want a team that can understand what you're seeing when you're looking at all this information. And you want a program that is continuously driving towards fixing the problems, driving towards excellence. And yes, we want to make sure we're complying, but mainly we want to make sure that we're doing the right things and the best things for our residents.
Mhm.
That's really what should be going on. And, unfortunately, a lot of these small facilities think they can't afford systems to do it.
Uh-huh.
And the bigger groups don't put their mind to the fact that maybe I should be rolling out a system that
Uh-huh.
should go to all of my facilities. That's what we're hoping we can change through podcasts like this, and
Yes.
keeping up the message and the conversation, right? Um,
Uh-huh.
we're almost near the end of the hour, Cedric. Can you
Wow.
believe it? Um,
There's
This is
that
great.
is
not hour, half hour, the half hour.
yeah.
Uh-huh.
So we always give our guests what we call the last word. So we're going to give you the last word. It could be anything you want it to be. The folks out there that are watching and listening, what's some great advice is what I would suggest. Give them some great advice. How can they make their organizations the best? That's what I would do.
How to make your organization the best, and it's really simple, is you listen. You listen, and you cannot. You have to listen with both ears and understand, and you have to trust your director that is in the building that can see really what is going on. And so when that trust is there, and then you have to allow them to allow them to change. Let them tell you what's going on and give them at least 45 days, a couple of months to try to improve. For example, something as small as My caregivers knowing their love languages, and also knowing apology quizzes. Love languages meaning money doesn't drive everybody. Gift cards doesn't, like things like that. Like figure out what your staff needs that drives them, and and organize your day to help them. Also, apology quizzes. A lot of times in these communities, people are arguing. They're not getting along. The caregivers, sometimes the directors. That sometimes apologies don't go over well. So making sure there's good communication, talking if there's anything going on, sitting them down, and getting that hashed out. Maybe that apology wasn't good enough. Figure out how they received that apology, but really just listening, accountability, and you will see a change. I was a director of a community. I did this, and it was successful. And
How
unfortunately,
quick was the turnaround, Cedric, once you started
prob-
doing it?
probably 30 days. 30
Wow.
days.
Wow, that's
30
incredible.
days. 30
Setting the
days.
right culture, setting the
30
right culture,
days.
investing in your people, there
Yes.
in your processes. There's you were able to turn an organization around in 30 days.
Yes,
That's
sir.
amazing.
Because they're happy to come to work. And the big problem in our industry is overtime.
Mhm.
Overtime is because staff, they don't come to work, they'll call in, and your dependable staff will take that shift, and now they're working overtime. But unfortunately, mistakes can be made because, as great as that caregiver is, that many hours, there's going to be a mistake made. So, to prohibit the overtime, you want your caregivers to enjoy coming to work.
Yeah.
And it sounds real simple, but I promise you, it is not done at a lot of communities. And the thriving communities, when you talk to them, that's the main component is listening and a family environment, and and
It's
caregivers
amazing
want to
what
come
you
to
can
work.
do with a culture of quality and having somebody who cares.
Mhm.
Yes, sir.
You know,
Consistently.
it's amazing what you can do.
Yes, sir.
Well, everybody, we've come to the end of our half hour for our live show of healthcare quality and risk matters. If you enjoyed our show, we really would appreciate a like out there on the show today. Share the link with your friends. Um, we will have a recording of this out at YouTube, so you can find us on YouTube as well. Just search us under healthcare quality and risk matters. And we're about ready to get started into our after show. Want to thank Cedric for being with us today.
My
And
pleasure.
we're inviting you to stay with us for the next half hour. If you're not familiar with our after show, folks, the after show is more about the solution. So we've talked about the problem. In the after show, we're going to dive into solutions, including a little bit about Aperitisoft Healthcare. Rob, tell us about the QR code.
The QR code is an opportunity for all of our listeners and viewers. There's to schedule a one-on-one with us to discuss your podcast ideas. There's or any one-on-one that you want to have with us around quality, risk, and compliance in healthcare and why it matters.
Thank you, Rob. And then one last little note, piece of business before we say goodbye. The December show is going to be a retrospective of the whole year. So we're going to look at highlights and lowlights and different things that we've learned over the course of the year. Hopefully you'll join us in December. That should be on December 17th, Wednesday, December 17th at noon. So we look forward to you joining us then. Thank you, everybody, for joining us for the live show. And stay on the line if you'd like to stay with the after show. We'll be with you in a few seconds. Thank you, and we'll see you next month. Bye now. Well, hello, everybody. If you're with us at the live show, we are back. And with the after show, the topic today is how do we strengthen senior care and trust in senior care. We have an esteemed guest, Cedric Robertson, with us today, and we're excited to have him. In the live show, we were talking about four main areas where could be the root causes of why you may be struggling in your senior living facility. We talked about culture. We talked about regulation. We talked about how the healthcare insurance industry is intertwined into the way that healthcare is often operated. And then lastly, we talked about regulations can sometimes be restrictive and misinterpreted, I would say, right, guys? on how the organizations are deploying those things. Rob made it quite clear that 3 of those things are really one thing, and they're all interrelated. You have culture standing by itself, but the other 3 items really are interrelated to one another. Cedric then also talked about leadership, and that was a main, if you're going to make a pie chart around culture, leadership was the biggest pie by far in the senior living care community. And when you tie that into culture and caring about what you need to do, Cedric told us you could turn around an organization in 30 days, and
Yeah,
that's
absolutely.
quite remarkable. So now let's talk about some more solutions, guys. Let's dive into this.
And sorry, I couldn't agree more with the being able to senior living, assisted living, skilled nursing facilities. They're often less than 100 beds, correct, Cedric? Would you say,
Yes,
or
sir.
around 100 beds? There's
About around that. Yes, sir.
And not that culture shift, not that process change, not that there's organizational development is ever easy. But when you have an organization that is staffed with 50 people, there's a very solid opportunity to have all of the people there's engaged, there's around cultural expectations of the organization. Excuse me. And using quality data, quality teams to interpret that data. There's to then make process improvements, track those improvements, track the incidents. There's do proactive assessments, continuously grow, and really your pathway to quality. Feels very doable. There's when you are an organization that size with the right culture and investment in leadership. And I know that we've shared this before, but that pathway to quality that we have, anybody that wants that graphic, please let us know and reach out to us. But that pathway,
Why don't you put it up, Rob? Let's put it up for those who are watching.
Covers all of that, right? It's the proactive risk assessment. It's the understanding what the expectations of your organization are versus what the outcomes. And then you really can't go any further than that until you have a system of quality. And then you have these 7 steps. There's your operating system. Excuse me, the dry weather is getting to me. But having a solid quality management system that allows you to proactively, assess, there's your organization, and then when something does happen, there's how are you ensuring safety of your practice, safety of your patients, safety of your organization, your building. And then with that base information, making strategic and cultural alignments, right? There's moving into constant improvement, adding technology, measuring and monitoring and maintaining that. And then you're going to achieve long-term quality and even HRO status. This is a hard road to navigate. With no system in place to navigate it, right? So think of it like your GPS. How do I get there? It's going to be really hard to use the old school map while you're driving. Sometimes it's not updated with construction or whatnot, right? You have the right operating system. You can easily navigate all of these stops throughout your road. Figure out where you are and how you're going to get to the next step. And Cedric, it starts like you're saying with the leader. Are they going to adopt? Are they going to adopt quality?
It's interesting, Cedric. This graphic. If you want to really dive deep into it and look at it, I'm sure it's the first time you've seen it.
Yes, sir.
But you see the circle with the 7 steps?
Yes, sir, I do.
The reason this is all very strategically laid out, but basically saying that if you don't progress to making quality a strategic part of how you operate and culture, which is what you said, right? Is
Yes,
that
sir.
what you said? Then
Yes.
You're stuck in the circle. You're stuck in
sir.
that circle. You're not going anywhere, right?
Yes, sir.
But then
Yes.
once you start getting that strategic mindset, okay, Now you're ready to start thinking about continuously improving your organization. Now, what we say is, look, you go back to the guys that did it wrong and they put measurement way out in the front, right? If you want to start developing measurements properly, okay, after you've achieved all of that, and you try to shortcut, you take the attitude of continuous improvement, you leap the metrics, you're cutting the corner, you're stuck in the trees, right?
I
You've heard
agree.
about, yeah,
Yes.
you're stuck in the forest, you can't get out. What we're saying is, wait a minute, no, get the right technology. And
Yes.
that's where we come in. Aperitisoft Healthcare gives you a quality management system that enables you now to look at metrics, build certain internally built metrics that are much more suited towards a quality standard than using the ones that are provided through regulation, right? Now you're on a pathway to a long-term quality culture, and ultimately you're now an HRO. And, you know, so we laid this out very strategically, this pathway, but the story you told in the live show basically followed everything that we have laid out here. And
Yes,
it's
sir. And unfortunately, Gary, unfortunately, assisted living, it's a little behind. I mean, a lot of times companies do not see they hear the value, but when it comes to them spending the money, it's just a hard thing for companies to do for some reason, to spend the money on this quality. And that is a challenge. It's a challenge.
yeah,
I see spending the money as just another set of numbers without context. There's
Yes,
right, they're spending the money on things that there's maybe they either shouldn't be spending the money on. There's or they're not making a smart strategic investment, right? They're stuck in that initial circle because they are right. They set a KPI, like Gary was saying. They went
yes,
right
sir.
to there's that measure, that monitor, that maintain. There's well, what are you maintaining that number that way for? Why are you reacting to that number without
yep,
context?
yep,
Why are you doing what you're doing? And if you have that 7-step safety management, quality management system absent, Gary's right. You've plowed right through all those trees in that forest. That's a hard road to take. And you
yeah,
have gotten some bumps and bruises on the way. And,
Yes, sir.
and there's no reason to do that when you can, Gary, I'm going to steal your words from a prior podcast, buying back your quality, right? You're not
yep,
investing in something risky. You're not investing in something that's going to throw your money away. You're
Mhm.
investing in your organization to improve its
yep,
buying power, to improve its by improving its reputation, but therefore improving its recruitment power, therefore improving its there's bedtime ratio. How often are people in those beds? There's in better utilization management, so you're maxing out your billing, which and hopefully that means patients are getting the best possible care, better patient outcomes, lower patient safety indicators and risk events that are
yep,
costing money. And I could keep painting that spider web and that additional
mhm,
path of how they are preserving their revenue line, how they are preserving their reputation, how they are strengthening trust in senior care. There's just by buying back their quality and putting their money in the right place. There's instead of again just having their finances be another number without context.
You know, Rob, I'll just get a little insight. When you talk to the decision makers for what you're talking about, they'll say, you know, Cedric, we understand and we know we understand this, but turnover is so high.
Mhm.
We don't see the value of purchasing this and putting it into place because the pieces are changing so much that it'll never be accomplished. And the conversation should be when you do put this piece in place, it will not completely stop turnover, but your numbers will change with turnover because of this quality. I think
absolutely.
they're kind of stuck right there. They just have to pull the trigger, and it's going to take a major company to implement this, or a smaller company. But when they see the results, um, not just in one community, but the culture and the conversation will change. This will be implemented. It's just going to take some time to somebody that's going to say this is going to work, and we're going to trust it, and we're going to give it. It might take a year. It's not going to be 30 days for this. It's going to take time, but now you're going to have better leadership, better quality, and your culture and your company name will turn around if it's in bad standing.
Yep.
So this is very important and it's needed. It's just they're scared of turnover. and that's what's stopping this thing from
It's
happening.
funny because you talk about that. It's interesting that that's what management do. But what they don't realize is that they've tried to make a shortcut towards getting to the top of the pyramid here. And look what we have in between innovation and HRO. It's a bog.
Yes,
You get stuck in the
yes.
bog, right? You're not
Yep.
going anywhere, right?
And,
And
and,
and so we were a little cutesy in this whole graphic design, but it's legitimate. It's a
yes, sir.
legitimate way of viewing what's going on here. And
Hmm.
we're not talking about major investments either.
Hmm.
With companies like ours, we're going to walk right alongside you. We're not leaving you as orphans,
Yes, sir.
right? We're going
And,
to show you how the system can be implemented and how it
mhm.
can improve what you're doing. And
Yes,
we're going
sir.
to stay right alongside you until that's achieved.
Mhm.
You
If
know,
I can chime in, it comes out of a different bucket of money. So for example, it could cost $25,000 to acquire one caregiver. From Google average to
yeah,
acquire one new employee, it could overall cost $25,000.
that's
That
just recruiting
turnover,
costs, right?
yes, sir. So if you look at turnover and you multiply that times the cost to acquire this staff, like that number should be so high compared to this quality piece that is significantly lower cost. But it comes out of a different uh, pile of money for these companies. So it's capital. There's a lot of different numbers that they work off of, but this quality piece is going to come out of a budget that they've set that they do not like to change. But they don't mind spending these thousands of dollars for Google ads and recruiting, even though it's turning over. That money does add up, but it's coming from a different area, so it doesn't impact them as much. So
And you think
yeah,
about the example you gave. Well, eventually, some of the referrals. Well, I guess first of all, you have residents that are there for a long time,
yes,
right?
sir.
Dear our close friend and user of this system, she has people in her facility over 100 years old,
Yes,
right? And they didn't enter at 100.
yes,
Mhm.
They're part of a family and a community, and they feel right at home there.
yes,
And that's what we're shooting for everybody who finds themselves living under in these kinds of facilities. It's sad that they need the assistance, but since they
yes,
do, it makes it we're making as comfortable a home as possible. And
yes,
tools, I mean, you see Monica made a comment here, how tools are helping to prioritize and put together a plan so that you can correct the issues. So it's aiding that leader that you talked about in the live show. It's
yes,
giving them a power tool. So if that was
yes.
accomplished with nails and hammer, imagine if you had nail guns to assist you. You may have turned it around in a couple of weeks,
I
right?
100% agree with you. Yes, sir. I agree.
You know,
We have a cost of poor quality calculator at Aperitisoft Healthcare, and staffing is part of that, staff turnover. And that can have such a massive impact, like many percentages of your total revenue line on turnover.
Yes, yes,
And so you're literally throwing it away. You're throwing cash away. There's when you're not investing in quality, because people do stay at organizations that they believe in. People
yes,
do stay at organizations where they feel like their license isn't in jeopardy, that the patients aren't in jeopardy. There's where they feel like there's a just culture of reporting.
yes,
We have a good quality management system where something didn't go great. And not only is it okay for me to report an incident, but it is supported and people are celebrating it, and they are happy that that additional data point went in for us to continuously grow and improve. And then it adds context to future data points. Like we're going to
yeah,
start understanding the bigger picture of our operations when we are collecting things on a daily basis, on a continuum.
yes.
uh,
Rob, just a little insight. So, reporting a problem, let's just say I'm a caregiver and I report a problem to the nurse. What if the nurse does not even have the leadership capabilities or the understanding of how to correct that caregiver's questions or problems, and it's considered a negative thing? So, what if that caregiver really wants to report something or they really want to get better? but they do not feel comfortable going to the nurse because the nurse could be negative towards them. So they keep that to themselves because that might require the nurse to do a little more work. She might have to go ahead and train a little bit more. She might have to that's more work. And sometimes people just at every level don't want to do more work. So a lot of times the staff member just will keep it to themselves or they might cover it up. So it's a lot that goes into that. So I think that's why you have to look at both sides of leadership. It takes a cohesive unit for that to happen. And your trifecta, your executive director, the marketer, and the nurse has to be on the same page, take constructive criticism. And yeah, it might take a little more work. Yes, we're going to have, but it's you have to be sometimes that doesn't happen. And a lot of these bad buildings or low performing buildings, that's the problem. It's just communication. Nobody feels comfortable talking to each other.
Now, I
And I
don't know
think
if you
that
answered the question that was put in front of you there, Cedric, but you might want to read that question from Monica and see if you've
Oh,
answered it or if you would add to that. Also, Christine, go ahead and scan that QR code, and we'll make sure you get a copy of that pathway graphic, and we'll answer any other questions you might have as well.
And the question is for those that can't see it, that are audio only. It
thank you.
says, Cedric, how do you believe greater influence can be shared with owners, quality, risk, and nursing leaders' perspective to advance consideration to see future results with stronger quality reporting?
That's a wonderful question, and it's tactful. Um, and that's I don't even have an answer for that. I say that because when you talk to other levels of leadership higher than you, sometimes that can put your job at jeopardy. As even myself, a lot of times you have to. It's tough. And when you work in these environments, Gary or Rob, you have to be tactful with your job and your career because you have a family. There's certain conversations like I know a lot of great directors and leadership that do know what to do, but they could be scared to have that conversation. It'll highlight them. They could possibly lose their job. This is really tactful. So it's going to take the right owner. Like it's tough. It's going to take the right owner, the right regional, and the trust has to be there. So that
Mm.
conversation will stay with them and they
Yeah.
can figure out that answer together. But sometimes that conversation gets out and it highlights the person that brought that to the forefront, and that's a tough place to
I'm
be.
going to
So,
ask the question a
uh,
little different, if you don't mind, Cedric. I'm
yes,
going to
sir.
add the question just a little bit differently.
Yes, sir.
How do you believe? Okay, um, let's put it this way: do you think greater influence can be shared with the leadership team? Okay, if they had stronger quality reporting. So, what we're saying
Answer
here
it.
is the system in place, stronger quality reportings coming out from that system, say Aperitisoft Healthcare, right?
Yeah.
So now, does that give leverage, give more influence to and from the leadership team to drive better performance in their organization?
100% because you can now see statistically and visually of the result. Yes, I believe it does help. Yes,
I agree. It's hard
yes,
to, especially when you're offering context, it's hard to ignore the numbers.
yes.
It is easy sometimes for leaders to maybe know something is going on, but ignore it. There's
Yes.
right to know that, hey, people are constantly feeling understaffed and there's no reporting of that. People are feeling like there's the call lights aren't being answered or whatever the incident is, no matter whether or not they think it's big or whether they think it's small. They're able to ignore it. If they're choosing to ignore those things, if there is not the story sitting in front of them in black and white. When that story is sitting in front of them in black and white, at that point, you go from there's ignorance and lack of awareness, right? And I'm using giant air quotes there, to now you are essentially being negligent. And you are having to actively choose to ignore a problem that is impacting patient care, people's licenses, and your organization's overall risk. There's whether that be legal risk, financial risk, or reputation risk, or all of the above, most likely. you are making the choice to ignore it if that story is sitting in front of you because you have a good system like Aperitisoft Healthcare that's painting the full story with context.
Yes.
And I think that is how you ensure a just culture. That is how there's the organization's leaders. There's have the right are forced to listen. But ultimately, we would like to think that everybody does the right things for the right reasons when they know better.
Yes. Uh,
That's what we want to do, is help people know better. And we
uh,
can do that by offering them the information.
Yep.
I have a question for you, Rob and Gary. Let's say I'm an owner or a regional, and I have 5 buildings. 4 of those buildings are 100%. They're making money, but their levels of care aren't as high. So even though it's assisted living, th- there's not a high level of care. Sometimes it's just where you're positioned, and sometimes you're blessed to just have a
Right.
community with low levels of care. That one underperforming building might have a great leader, but the caregivers are put under more pressure because there's more work to be done. But overall, the company is winning because there's four locations that are doing well, but there's one that is struggling. But when you put it in the whole collection, they don't feel it as much. So the value for them to fix that one, sometimes they just say, "Oh, that's just how that building is," or "That's just how it is." So they focus on the other four, and they just kind of just hope that
Yeah.
building, but with your system, if you put those systems in place at the underperforming building, you would have 5 great buildings. But
Right. And
they
what
look
you
at
know
the
what we do at
collective.
Aperitisoft Healthcare is you can dissect how you want to evaluate your organization anyway. So in your
Yes.
scenario, we would probably say, look, don't worry about departments as much. Okay. Look at each building. You got 5 buildings. Each building has its own risk profile. And therefore, management now can drill in and see what are the main reasons why they're struggling. Right. And now
Mhm.
we're back into that corrective action, preventative action management. Oh, I think we lost Cedric. The hospital may have pulled his plug.
Mhm.
Oh, well. He was in a hospital. For those who are listening, he was in a hospital, but breaking from his busy day. He was evaluating a patient to come into one of the facilities and took the time to be with us today. So we really much appreciate that.
And unfortunately, it is not letting me add him back in. I'm so sorry, Cedric.
Is he waiting in the waiting room?
He is back in the waiting room. And so I'm so sorry for all the listeners. We're having technical difficulties.
Cedric,
And
if you're hearing us, go back out and come back in again, please. Before we begin to wrap up, we're near the end of the full hour now. Believe it or not, Rob. Audience, what other questions do you have? Let's get some final questions for Cedric or for Rob and me, and we're glad to give you our perspectives. We certainly are glad you're with us. That you guys make this show possible, and we know that's the fact. Your support has been wonderful, and we're going to continue to put out some quality shows for you. Another thing you could do in the chat, give us some ideas and some topics you'd like to hear about. We're going into a new year starting in January. We'd love to get some ideas from you of what you would like to have in the calendar next year. So please put those in the chat as well.